You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's show, we have a returning guest. Her name is Sarah. She's one of our nurses, and she was on one of our last episodes. So I want to welcome Sarah back to our show today.
Thank you so much for having me again.
Very good. Well, thank you for making time for us. So Sarah wanted to share an experience that she had with her sister. And so what we'll do is go back in time a little bit, and she's going to talk about her sister and some of the illnesses that she had when she was younger. And then we're going to walk through the progression of that. So tell us, Sarah, what happened when your sister was about 2 years old?
You know, a lot of people don't know about this, and especially for those that are not in the medical field or they don't experience these things on a daily basis. But with my sister's case, she was 2 years old and she had a high-grade temperature, close to above 102 at the moment. And obviously I was little and my siblings and my mom had to call the ambulance because she started having seizures. At the time when they took her to the hospital, they put her into cold water for her to break her temperature. But by that time, a portion of her brain was damaged. So after that, you know, it was a complete life change for all of us and especially for my sister because she was born as a normal child. After that, she went through a lot of recovery, medications, and all of that.
Sure, I understand. So it looks like around the age of 2, she spiked a fever for some unknown reason. It sounds like you never found out if it was a flu or a bacterial infection. And then the fever was so high that her body began having seizures. So the medical term for that is called a febrile seizure. And febrile seizures are very common. They actually occur in perfectly healthy children. They don't usually occur in adults, but they occur in healthy children once the temperature hits a certain amount. And it causes some metabolic changes, meaning the body's metabolism changes and it creates chemicals that are toxic. And that causes the spasms of the muscles. And if the temperature stays high enough and the bacteria or the virus keep on developing, it affects the brain. And the medical term for that is encephalopathy. So it sounds like your sister was diagnosed with encephalopathy shortly thereafter.
Yes.
Okay. So she was hospitalized?
She was hospitalized for a while.
Okay. So she was there for a week or longer?
To be honest, I think it was about a week that she was there.
Okay. And then after she was discharged, did she return home or did she have to go to like a special care facility?
She was sent back home.
Okay.
But after that, there was a lot of different appointments that my parents had to go to with her.
Sure. And then they did CAT scans or MRIs to diagnose the problem. And then she followed up with a specialist?
Yeah, she did go to a specialist. My parents were obviously it was a life-changing experience for them. And they went to, I'm not sure which specialist it was, but they told us to go to Texas Children in Houston for her treatments.
Excellent. My guess is that she probably saw a neurologist at some point, and they did their routine testing, which would include either CAT scan or MRI to identify which areas of the brain were damaged, and then they probably did an EEG. So an EEG is where they hook up these small wires to the brain. It doesn't hurt, there's no pain involved, but they measure the brain waves. And so people who are having seizures will have abnormal brain waves, and they can diagnose a seizure disorder called epilepsy based on that, and they can also identify which areas of the brain are not functioning. Now, the good thing with children is that they do what's called remodel the brain. So remodel means if you lose a part of the brain from encephalopathy or a stroke or a blood clot, if you're very young, you can actually regrow it. You can actually learn those skills again. However, if you're an adult or if you're much older, neurons or brain cells, they don't regrow. And that's why a stroke in an adult where you lose brain function, where you can't speak or you can't move your arm or you can't do the things you normally do, that's the reason, is that the brain in adults, it can't remodel. It's not able to redevelop or relearn those skills. But in children, they're very plastic. They're very able to mold and to actually learn some of those skills. Now, was your sister speaking at the time, the episode of encephalopathy, or was she not verbal in that time?
Before that happened, she was verbal. But after that, she had motor skill problems from being able to sit up straight for, things of that sort. So it was a complete, it was like starting all over again.
Sure. Sounds like it was very devastating, in that regard. And oftentimes those children will go through a period of rehabilitation. So usually that's a speech therapist, which will help them not just with speaking, but with swallowing, because swallowing and speaking are directly linked. You have to have your tongue, your vocal cords, all your throat muscles working in conjunction to prevent choking, to prevent aspiration pneumonia, that's where you swallow food into your lungs, and to prevent things like gurgling, which is where saliva and secretions will get stuck in the throat, which can cause infection. So speech therapists are very, very skilled at what they do. They work with children and adults, and those are a very important part of the team. And then there will be physical therapists and occupational therapists. The difference is that a physical therapist generally works with range of motion, for example, to get your arm or your leg moving again. Occupational therapists work with your skills. So if you're trying to button a button, or if you're trying to write your name, or if you're trying to learn to drive or go up the stairs, oftentimes an occupational therapist is very well suited for that. And then in the school system, was she enrolled in school at a later time?
So she was enrolled into regular public school, but she was in the special classes. She wasn't able to be in part of with other students. She had a separate classroom that she would be in, which was great. There were great teachers there. They were help with, writing, reading, any of the small, occupational therapy thing, like how to pick up a fork or, things like that. They would help her.
Good, good. And then your sister improved, and eventually she graduated from high school?
Yes, she recently graduated from high school. If you look at her now and from before, it's like a big difference thanks to the medical field and the therapies that she's been through.
Absolutely. And that's really the key, is that encephalopathy, it can be devastating, and people can often die from encephalopathy. They never make it out of the hospital, and the ones who do require years of rehabilitation. So I'm very pleased to hear that she did improve. We alluded to the fact earlier that we're not sure if it was a virus or a bacteria that caused it. It's very similar to meningitis. So meningitis is an infection of the brain, which can be caused by meningococcal bacteria. It can be caused by influenza. It can be caused by strep bacteria, E. coli, different parasites. There's a variety of things that can cause it, but the end result is damage to the brain. Yeah. And that's always the most serious complication with that. Now, your sister, as she got older, did she continue to have seizures?
She did for a while. It was a few years, probably a good 6-7 years even after that she was having seizure attacks, which would, at first it was every month, and then it went to 3 months, and then 6 months, and then eventually they stopped, but they were, just randomly. You would never know she would be at home or anywhere it could be possible.
Absolutely. And seizures are due to electrical activity in the brain. It's almost like a short circuit where the normal pathways in the brain are disrupted. So again, because part of her brain unfortunately died, the remaining part of the brain had to remodel around that. And it causes electrical activity to stimulate muscles, which is what we call a seizure. There's different types of seizures. Some are where the arms and legs are moving wildly. That would be a tonic-clonic seizure. Other seizures are what's called absence seizures, where you're talking to them and all of a sudden their face will go blank and their eyes will stay open and they're not responding to you. And that can happen many, many times an hour, and you don't even realize it.
Yeah.
And then there's petit mal seizures, which are slightly less, but they're still seizures. And it's all because of the electrical activity in the brain. And she was on medication for the seizure control?
Yeah, she was on medication too. And I have to say it was really, really strong medication that the doctors had given her. And I just remember, that my parents would have to give her once a day. It was a liquid form. It was very strong. Even if we were to taste it a little bit, it was just horrible for a child to take.
Sure. And there's several medications in that category. There's medications like Depakote, Tegretol, Keppra, and these are all seizure medications to lower that seizure threshold, to avoid that static and electricity in the brain. And I'm glad that she outgrew them. That is a very positive sign for her. Is she still on medication for seizure control?
No, she's not on any medication related to that. Not at all. She does the normal, she walks, she's able to talk. There's a little bit of motor skills that she lacks, but on a daily basis, she's able to do everything that independently on her own compared to how she was when she was 2 years old to now. It's a big difference.
Excellent.
Yeah.
Well, I'm very pleased to hear that she got the care that she needed from the family, from the specialists, from all the therapists. I think that made a major change in her lifestyle. So unfortunate as to what happened, but I'm very glad that she progressed to the way she is now. Do you have concerns or questions that you wanted to ask me about her situation?
I think for other parents or people that go through this, what are the red flags for people to know that to take this situation seriously?
Absolutely. And I always start with the basics. So a temperature or a fever in any child or adult, you should take it seriously. meaning offer them Tylenol or Motrin to control the symptoms, bring the temperature down as much as possible, wear loose clothing, do whatever you need to do to bring that body temperature down. If you're not successful, you need to see a doctor, whether it's your family doctor, pediatrician, urgent care, or ER, and let them do the testing, whether it's the flu, whether it's strep, whether it's something else more serious, because that early time is the most important time. And if you can prevent the febrile seizures, you can prevent a lot of the complications. And also, if you can catch or detect meningitis or any of those very serious bacterial infections, you can start antibiotics immediately or antivirals immediately. And that's why, as doctors, oftentimes we do so much testing in that early phase to catch those high-risk situations. Certainly not every child who has a fever is going to end up with brain damage, but we try to identify who those individuals may be. So that's always the advice, is take things seriously, always consult with your doctor early in the process, and give the medications at home before you go in, whether it's Tylenol, Motrin, or just IV hydration or fluid hydration. Whatever you can do to prevent that child from getting worse, I think is always the most appropriate advice. Even simple things like the flu vaccine. We recommend the flu vaccine for everyone, pretty much, because it prevents the flu. People do still get sick from the flu, but it's one of the few things that will prevent those complications. We also recommend meningitis vaccine for almost everyone, because meningitis is devastating. And there's different types of meningitis vaccines now because there's different types of bacteria that cause meningitis. And then also with all the childhood immunizations. Many people have come out against immunization. They feel like there's a link with autism or other developmental delays. I don't believe in that. I really do believe that vaccinations save lives. I really do believe that it is beneficial for all countries in the world to continue offering vaccinations because we're trying to protect our children and future generations. So I still believe in vaccinations as the first step.
That's good, because I think the newer generation is more afraid of getting these vaccinations because you hear all these things on social media, like kids getting sick by getting some kind of vaccination done or etc. So I think that's another fear that parents have now regarding those.
Absolutely. And there's a lot of information, but also a lot of misinformation, whether it's on purpose or by accident or shared inadvertently. So I always tell people, have a frank, candid conversation with your doctor, listen to what they say, then research it, and then go back to your doctor and advise them of what your concerns are, and then hopefully the two of you can come to an agreement for your child's sake. Once they're an adult, it's on them. If they choose to get vaccinated as an adult, but when they're 3 years old, 4 years old, really you want to do what's in their best interest. And I would say vaccinations remain one of the few things that can prevent many cancers, many infections, many lifelong disabling conditions. So I strongly support vaccinations for sure. Very good. Any other final thoughts or anything that you would like to say? Maybe some positive words of encouragement for other families who've been in a similar situation?
I would say it's a really hard experience to go through. And I think this is a great way for people to gain knowledge and for their future. And this will help them a lot, hopefully.
Excellent. Very good. Well, thank you so much for sharing your details about your family with us. I know it's a very emotional, very deep-seated type of situation. So thank you so much for being open and honest with us about that. I do think I'll have you back on the show in the near future. I'm sure we'll do some more episodes as well. You've been listening to Simple Health Radio. I've been your host, Dr. Emron, and I do hope that we'll have you all back again as an audience in the future as well.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 & Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.